Hi, my name is Pauline Isabel Centeno from PSN2A, and today I will demonstrating how to get the blood pressure measurement. So, blood pressure measurement is very essential for us to have a proper diagnosis for the client and to monitor the physiological state of the patient. It also ensures that the patient will receive a proper treatment and interventions, and lastly, it will help us to determine if the patient is at risk or in danger for hypertension or any cardiovascular diseases. So, the materials needed are the stethoscope, sphygmomanometer, and then the notepad and a pen. So, first, we need to assess the client in identifying the client. So, Ma'am, are you Hannah J.T. Centeno?
Yes.
So, in identifying the client, it will help us to prevent incorrect identification that can lead to medical errors and failure to treat the patient problem. So, the next thing is we need to do is to explain the procedure to the client. So, Ma'am, today I will get your blood pressure measurement. Is that okay?
Yes.
So, in explaining the procedure, we will get the consent to the client, and we will gain the cooperation of the client, and it will lessen the anxiety and irritability of the patient. So, the next thing is we need to ask some questions that are related or that may affect the blood pressure reading. So, for example, we may ask the client if she or he rushing to be here or do a physical activity before the blood pressure reading. So, with that, we can assess if the client have high blood pressure, which is not normal because it is just only the cause of rushing or doing physical activity. So, Mom, are you rushing to be here?
No.
No. So, if she said yes, we can have the client rest to at least 5 to 10 minutes of rest to have proper or accurate blood pressure reading. So the next is we can ask the client if she or he had medication that affects the blood pressure measurement. For example, if he or she takes some diuretics or beta blockers. So we can also ask the patient if how was his diet. So, how was his diet and physical activity, because it can affect the blood pressure reading. So, the next thing is planning. So, in planning, we need to first wash our hands to avoid the transmission of microorganisms that causes illness and diseases. So, the next thing is we need to gather the materials needed to save time and effort and to avoid distraction while doing the procedure. So, we will now proceed for implementation by taking the blood pressure measurement without the use of stethoscope. So, first, we need to assist the client in supine or sitting position comfortably, and then the forearm of the client must be at the level of the heart, like this one. So, at the level of the heart with the palm facing upward. So, why we need at the level of the heart? Because if the hand of the patient is too high, we can underestimate the systolic and diastolic pressure, and if it is too low, we can overestimate the systolic and diastolic pressure of the patient. So, it must be at the level of the heart. So, after that, we will now expose the brachial area of the patient so we can easily wrap the cuff around the patient arm. So we will now wrap the cuff of the patient arm. With its center is 2 cm above the antecubital fossa. So here, so we can have an access to the brachial artery. So after that, we will now So, ayan. So after that, we will now palpate the brachial artery of the patient using our index and the middle finger. So the brachial artery is in here. So after that, after feeling the palpation of the brachial artery, we will now apply enough pressure so we can distinctly felt it. So we will now close the ball by turning it clockwise. And we will inflate the cup 20 to 30 millimeters in mercury. So just feel the pulse of the patient. So we just wait until the pulse disappear, and then we will release the cup slowly, and then note the first and last palpation we felt. And then deflate the cup fully. So after that, we will now allow 1 to 2 minutes interval for the next BP measurement. So we just wait 1 minute for the next BP using our stethoscope. So after 1 minute interval, we will now place our stethoscope by the tips pointing outward. So we can hear clearly the sounds of the brachial palpitation. So we just make sure that the stethoscope is open by turning or twisting this around. So if we hear the sound, it is open. So after this one, we will now palpate the brachial artery of the patient here, and then we will place the diaphragm of the stethoscope over the brachial artery. So ayan. So after placing it, we will now close again the valve by turning it clockwise. And then we will inflate the cup until the sphygmomanometer raises 30 millimeters in mercury above the anticipated systolic pressure. So after that, you will release the bulb carefully so that the pressure decreases about 2 to 3 millimeters in mercury per second. So release it. And note the first and last sound we heard. And so we just carefully. And its corresponding pressure on the pouch. So, and then deflate the cup fully. So, after that, we will now take off the cup to the patient. And then note the result in our notepad. So after that, after noting the result in our notepad, we will now relay the result to the patient. So mom, your blood pressure is 110/78, so your blood pressure is still in the normal range. So relaying the result will help the client to aware about his condition. For example, if he has a high blood pressure, so we can explain it to her that her blood pressure is in normal range. So, for example, if we have the patient who still have a high blood pressure, we can modify our nursing intervention for that client. So, for that, we will now wash our hands to avoid transmission of microorganisms and that can cause illness and diseases. So, for evaluation, we will now evaluate the blood pressure in accordance to the baseline data and normal range of age. So, because in each age, we have different blood pressure normal range. So, we can evaluate it and we can find out if the patient if a high blood pressure or has a low blood pressure or still in the normal range. For the documentation, we must document the blood pressure of the patient. Why? Because everything which are not documented is considered as not done. So, lastly, we must note and report any significant change in the blood pressure of the patient. Like what I have said, so if the patient is still have a high blood pressure, we can modify our interventions or recommend to the doctor that he or she needs some medications to lower her blood pressure. So, that is the procedure of the blood pressure measurements. So, again, my name is Pauline Isabel Centeno from BSN 2A. Thank you po.